Hey guys, wanted to get this out to you before Sunday night, Monday morning, because it is a lengthy one. Um, I've sent everybody shopping, and I do have my dogs, but they're sleeping. And there's some noise coming from upstairs in my house, but it's probably not my son because I'm actually allowing him to play Xbox. And the turtle's digging in his rock, so um, we may, we should be good. All right, so this one it's titled. The whole thing is like child adapting care for child. There's just a whole lot of other stuff in here. And I know this PowerPoint is long, but I combined 3 PowerPoints from the class when I inherited it. It had like 3 PowerPoints, so I just combined them all into one. Take it bit by bit. Don't sit down with all 150 slides. Separate it up. So it kind of deals a lot with contagious diseases and immunizations in the first part of it, and then it goes to more of the common childhood illnesses. So when a baby is born, obviously their immune system is not mature. When they're in utero, they get antibodies from mom. Their protection is limited, and then once they're born, that protection slowly starts to fade. Um, they do get their Hep B immunizations at birth, but generally they don't get a whole lot of immunizations till about 2 months, so their protection's incomplete. And the way that the CDC has really set up their immunization schedule is what risk factors that baby's at based on their age. So they want to get their immunity boosted as best they can for whatever age that baby is. So as you guys know, the chain of infection and to cause an illness or a disease, this chain needs to be broken. I'm not going to get into a whole lot. That's pretty much fundies. I know I taught it in CNA class. So modes of transportation, it's just basically how the bug is transported. Direct, there's an actual physical contact between the source of infection and the new host. So it's directly related, like say if I have HIV, if I cut my finger and I directly expose another person through a cut, through a sore, through bleeding ulcer, whatever, I directly have contact with the new host. Indirect, these are when, if say I cut my finger and the bugs and wipe my hand on a table, so there's blood sitting on that table, and somebody else comes by with a cut and rubs that same spot, so that there is another object. So there's another object in between me and the new host. Vaccines, basically what they do is introduce antigens into the body, which is our next vocabulary word. It's just a foreign substance that triggers an immune response. It can be vaccines for, the general ones. This is kind of what the allergy attacks or allergy immunization, or allergy shots that some of the kids got when we were in Boston. They did a lot in infusion. The body's immune response vamps up, and they make antibodies, which are the proteins that fight whatever the allergy or the disease or the illness is, in response to that substance that is triggering the immune response, the antigen. So I hope that all makes kind of sense. Immunities, we've gone over these a million times. Active, the body's making antibodies without presence of the clinical disease, so they may be using a vaccine. Passive, Antibodies are made by another person and transferred. So the example is here is mom transfers it to her baby, her fetus, while it's in utero, and that's the passive immunity. And just so you remember, it does not count for a long-term immunity. Types of vaccines, I'm not going to get into a whole lot of this. There's the killed virus, the toxoid, the live virus, recombinant form, and the conjugated form. So just know that there's different types. Don't usually recommend the live virus to immunocompromised patients because it is a live virus and they can actually catch the disease or the illness from this. And I know they do make a live vaccine for the flu shot. My kids always thought that it was better than getting a shot. Well, my son did, and so the girls got their shots, and I allowed him to make the choice that year. The nurse Mono is really good at saying, okay, well, you're going to bleed when I put it up your nose, you're going to get sick, and laid everything out for him. But my kids are, they've grown up with healthcare with their entire life, so I allowed him to make a choice, and he got sick. It was terrible. So he now gets the shot every year and doesn't even question getting the live virus nasal spray. The CDC always puts out the recommendations for the immunizations, and you can look them up on the CDC website. They go in and they update it routinely. They also have a catch-up schedule or even a supplemental vaccine, so that way if the child is behind on their vaccines, they can get caught up relatively quickly. So this is kind of one of my favorite topics, and I will tell you my stance on it, and I'm not an anti-vaxxer. I'm not a huge person for getting vaccines. My children are vaccinated, but they are vaccinated with only the mandatory ones. And that kind of comes from a personal experience. I do recommend that we continue to vaccinate our kids because otherwise we're going to have terrible, terrible, terrible outbreaks. But I'm very picky about which vaccinations my kids get. So I will be very open, but I'll also be very kind of neutral on this next topic, this barriers to vaccination. So what are some reasons that parents decide not to vaccinate their kids? Well, some of it is economic factors. We're living in a time that not everybody can afford health care, and it takes a while to get set up with Badger Care. Our county does have a where they give the immunizations at a very low cost at the county building. So there are kind of ways around it. I know our school was going in and giving the flu shot to kids, but I really hate to have my kids get a shot without me there. I've had some experiences with my children getting not vaccinations, but shots, and I prefer to be there. That being said, there might be some limited access to health care. We all know the clinic that you call to get in for a simple checkup, or if even something's wrong and you can't get in for 2 months. Or maybe, like I said, they don't have health insurance. Another thing is that the clinic's only open during working hours, and maybe mom and dad leave the house at 7 in the morning and get done at 5 p.m. So they're only open during the clinic working hours. Some clinics, I speak a lot more of the rural area because I'm more familiar with them, but some clinics, I know my clinic stays open till 8 o'clock on Tuesday nights just for this aspect, so that people who work all day, every day, will have a chance to come in on Tuesdays. Plus, they also do the special children's clinic down there at that time. But so that could be a barrier too. Maybe sometimes the parent doesn't understand the importance of the vaccines. They see that, oh, well, my kid doesn't need to get the chickenpox vaccine because it's not popular anymore. Like the disease isn't prevalent anymore. Well, there's a reason that the disease is not prevalent anymore. It's because it has been really toned down to from what it used to be. Growing up, we used to have chickenpox parties, and I'm not lying, so you can ask anybody that's older. I don't remember when the chickenpox vaccine came out, but go ask your parents or, older adults. We used to, if there was a kid in our neighborhood that got the chickenpox and we hadn't had the chickenpox yet, our parents would literally take us over to play with these kids. I mean, they'd be sitting there scratching and oozing all over us, and they'd be like, oh yeah, keep playing, just so that we could build up our own immunities to this. And we didn't have the chickenpox vaccine, obviously, but this is what we did because it literally, once you got the chickenpox, you built up an immunity and you never got it again, and it was so much worse when you got older. A lot of times there's a religious aspect to it, depending on the family's religion. Concerned that the vaccine is dangerous, that it might cause autism, which I did learn that the guy that started this, that it does cause autism, was literally put in jail for fraud for that statement. And it might cause SIDS. I also do have a friend that is an anti-vaxxer because her son, after getting, I think it was the MMR, but I'm not really sure. After getting that vaccine, he actually went deaf. So now she homeschools her kids so that she does not have to vaccinate them. Super wonderful, super smart, amazing nurse. I love her. She was actually one of my tutors when I was in the nursing program. And I guess I can't blame her in that aspect. Some parents might feel like, oh, that vaccine's not going to fully prevent the disease. But as we go through some of this, you'll see that the pertussis, the whooping cough, the pertussis vaccine, the kids that are vaccinated might not actually have that whoop when they cough and then and get that stridor coming back in. So it may not actually fully prevent the disease, but it will prevent it from getting as severe as it can get. A lot of times the kids that are vaccinated have a less complications. Some people feel that the government might be monitoring the vaccination status. Well, in a way it kind of is, but I don't think it's to the point that they're trying to monitor everything we do. But like I talked about, some parents feel like this disease is not a threat anymore. And that's because we have vaccinated for so long that these diseases are getting wiped out. As you see more of the anti-vax movement, you'll see that some of these diseases are coming back. Some parents believe that they can control the child's exposure to the disease, but sometimes you don't even know. Sometimes you're exposing it to people who don't even know that they have the illness, and they're passing it on to you 3 days before they're diagnosed with it. So, good example of that is the influenza. You might not know, maybe because it starts as a cold. Yeah, you're running a high temp, but you still got stuff to do, so you're out in the community doing your stuff. Somebody's got their kid out, you're at the grocery store, they use the cart you used, bam, the kid's got influenza. So you can't always control your child's exposure to the disease. And then side effects from the vaccine do not justify the benefit. I did save this one for last to tell you my personal story, only because I usually do have Bailey come in when we have a face-to-face class. I do have Bailey come in and talk to you guys about the stuff that she experienced as an 11-year-old fully engulfed in the healthcare system with no answers, bad nurses, good nurses, and the effect it had on her. I can kind of go through that. I'll throw up another maybe another YouTube video and have us sit and talking about it. But a lot of times, had I known now what I didn't know then, I would not have vaccinated my daughter with the HPV vaccine. There are hundreds of HPV strains out there. The vaccines only cover a certain amount of them. I think they're up to a vaccine that covers 13, but at the time it was like a 4 strain when I gave it to my daughter. You guys have heard me, some of you guys have heard me talk about my daughter having POTS. Well, that paired up with a appendectomy and getting the Gardasil vaccine is what we feel like caused the POTS. There are a lot of studies out there right now about the sorry, my turtle's digging. It wouldn't be my lecture if I didn't have some animal making noise. There's a lot of studies out there saying that the links between the POTS virus, the POTS illness and the Gardasil vaccine. But like I said, Bailey and I might throw up a video later, just so you guys can kind of hear her side of a story. It is kind of eye-opening to hear. She's 16 now, and it was 5 years ago, but she still goes up to Gunderson, and there's one nurse up there that, if we're up at Gunderson, she's came with me to drop off, like, assignments for clinicals, and she, every time we're up there, she goes to the peds floor and looks and see if Kim's there, because Kim was the one person that helped her get diagnosed. So, that being said, if you do have parents that aren't vaccinating, make sure you're talking to them and finding out why. Maybe it's a myth they heard, or maybe it's just some misconception they have, or maybe it's a true thing. I know my ex-husband took my son and got vaccinated with the HPV vaccine after Bailey was diagnosed and after we figured out what part of the cause was, and I did kind of lose it, and I was a little crazy, but that's okay. But so always talk to your parents and find out what their reasoning for it is. So when we're in the clinic and we are looking at our kids, trying to determine what we need for them, we need to look at their immunization record. A lot of time that is on their medical record, but we can also look it up on the Wisconsin Immunization Registry, because if they've gotten an immunization somewhere else and it was not contacted to the facility that they're at, it will be on there. If the kid's behind, we need to look at that catch-up schedule so that we're making full use of every opportunity we have to get that child up to date on their vaccinations. Illness or fever is not a contraindication to getting vaccinated. The only contraindication that is considered is if that child has gone into anaphylactic shock from a immunization. I know we stress, and I do it too, I still do it, taking a temperature before a flu shot. Honestly, if they are, if they come to me and ask for a flu shot, 9 times out of 10 I'm going to give it. The only times I have refused giving a flu shot, because I gave them as basically the employee health nurse. I was staff development or something. Yeah, staff development. So I had a lot of hats on, but one of my jobs was to give flu shots. And the only person I would not give it to was my friend who was pregnant at the time. And I don't remember, I know she went to the clinic to find out if she should get it or if she shouldn't. I don't remember if she ever got it or if she didn't, but her provider was very thankful that I didn't just give it to her. So that being said, the only actual contraindication is if that child has an anaphylactic shock. So when we are going to give a vaccination, we always need to ask about past reactions. If you had this vaccine before, how did you do with it? You know, if you're giving a flu shot for, their 5th time, how have you done? How was, did your arm get sore? Did you, contrary to what everybody says, you might want to talk to them about getting sick after a flu shot. You want to ask them if they are allergic to any of the vaccine components. I was asking if people were allergic to eggs before I even knew why. So like eggs, gelatin, neomycin, they're all in the medium that's used to grow out the flu vaccine. So you always want to make sure that you're asking them if they're allergic to eggs, gelatin, or neomycin. And then, sounds kind of funny because we're talking about kids, but you want to ask if there's any possibility they might be pregnant, or might be pregnant in the next 3 months. It's not uncommon for kids to be pregnant nowadays, and you may have a 16-year-old that's here to get flu shots so she can, because it's recommended, and she's worried that she might be pregnant. Well, you need to ask about these things. Generally ask away from the parent, but make sure you're asking about these things. So these are just some NANDAs related to vaccinations. Prior to administration, we have on here, I do kind of sound like a pro-vaxxer. I'm kind of neutral on it. I think it's everybody's, it's case-by-case scenario. We need to make sure that we're telling our parents possible side effects. Oh, what is that scream? I'm going to have to look it up. I'll put a little announcement, but there is one vaccine. I think it's a DTaP. Yeah, it is a DTaP. Before it was a DTaP. One of the side effects was uncontrollable screaming, like 3 hours to the second. 3 hours after getting the vaccine, these kids would scream for hours, and they'd be inconsolable, and it was just a side effect of the vaccine. I'll look up an article or something and get that to you guys. I don't know if there's a quiz question or what, but there was something, and maybe it was I don't know. I'll have to figure it out. We have to make sure that we're providing written and verbal information. The CDC has some handouts that we always give. Those of you who have given flu shots on clinical with me, those are the VIRs that we give. And we always need to make sure we're getting consent. Be efficient, but we need to make sure that our kiddo is our main priority. Need to make sure that we're doing an IM and not a sub-Q. And don't tell them that it's not going to hurt. You can tell them that it'll be like a little bee sting, but it'll be over before you know it. You can get 2 nurses if there's more than 1 nurses, or more than one injection that needs to be done. You can get 2 nurses and give them at the same time so it's over and done with, and they don't have to, get poked 3 separate times. And then a lot of times, instead of having the kiddo lay on the cold exam table, have a mom or dad hold them so that way they can comfort the child. I've given and had my kids receive injections where I had them like sitting where their stomach was against my stomach and their legs were hanging on my side. And that way we just pulled the chair out in the middle of the room. They held their legs down, or that's how we did it. But it really helped to comfort that kiddo. I know there's these new contraptions out now that take the sting out of the injections. If anybody's ever used those, you guys should let me know because I want to know about them. I don't know if it's an ice pack or what exactly it is. So when we're charting, we need to make sure that we are charting the date that we're giving, the vaccine that we're giving, the manufacturer, the lot number, and the expiration date. So that way, if there is an issue with those vaccines, it can be traced back. We need to make sure we're charting the site and the route of administration. So it would be left deltoid IM. In case that the vaccine actually causes, any type of tissue damage. And then the name and the title of the nurse giving the vaccine, which is how we sign it. A lot of these times the sticker can be peeled right off of the vaccine if it's a pre-filled syringe, which a lot of them are going to. And if there's any paper charting, that can be stuck right on there. So after the vaccination, we're going to give the mom or dad or the guardian the updated immunization record. And then we're going to give them any ways to manage these mild reactions at home. You know, some of them might cause a mild fever. Like I said, that scream, which they're getting away from now because they've changed the vaccine a little bit. Tylenol, those types of things. And then to have them call us back with any major adverse events. Alright. So child communicable diseases. Some of these are childhood diseases. Some of these are ones that have been wiped out with the vaccinations. So it's just kind of a hodgepodge of communicable diseases. But they're all pretty good to know about. And I know you're looking at this going, oh my gosh, how am I going to ever remember all of these? Like I said, I took a lot of PowerPoints and put them into one. And I will kind of go over the disease, what we need to know about it. And I did put up a graph that has the disease, the transmission, the cardinal symptom, the other symptoms, because 9 times out of 10 they're going to have flu-like symptoms with a lot of these illnesses. And then some of the important things for treatment. So let's get started on these. Chickenpox. It's also called varicella. This is also the virus that causes the shingles. So once you've had chickenpox, later in your life you're at risk for shingles. So that being said, that was just an FYI. Transmitted direct contact of the virus, either airborne or contact. However, it's basically a direct. Like I said, chickenpox parties. We would sit and play with toys. We would sit and watch movies. Whatever they wanted us to do to be in contact with these kiddos, so that we would get chickenpox as well. And if you look on here, there's different stages of the chickenpox, and that would be the best time for us to go play with these kids, was because some of these, it starts out as a papule, but then you can see like the blister and the ulcer, they're open, and they're going to be draining this crud, and that's what they wanted us to get in touch with. Biggest thing on this one, just know that these kids are contagious until every one of those lesions, like in this slide, every one of those lesions needs to be like almost in the scabbing scabbing level, so that it's all dried up and there's no more of that gook coming out at us. So symptoms, obviously, are going to be like the flu-like symptoms. First, that kid's going to have fever, fatigue, anorexia, headache, abdominal pain, and irritability. Kind of like generalized. So the part that I really like you guys to remember is that this rash, it'll start out as like a little pink papule, very small red raised area. It'll go up into a fluid-filled blister, and then eventually it will crust over. It can last a week. These kids might actually have lesions that are in the papule stage, and then some that are crusted over, and some that are with the fluid-filled blisters. So they can have different lesions at one time in every stage there is. Sorry, my old dog is hobbling around here. My poor dog got diagnosed with Cushing's disease. You never know what's going to happen in my house, so I feel kind of bad for my fat old dog. So she gets to wander and do whatever she wants. Anyways, chickenpox, the treatment, basically treat the symptoms and monitor for any complications. I've seen kids with the chickenpox lesions on the inside of their throat. That was terrible. On the inside of their ears. Every spot on their body, inside their nose. These kids were miserable. And on top of that, that kid has asthma as well. So breathing was a huge, huge worry. Hold on, I just gotta put my dog up on the bed. Ugh. Like I said, my fat old dog is now diagnosed with Parkinson's disease until I can get him to treat her. I'm kind of babying on her. It's like, it's a dog bed, but she couldn't get up on it. And here comes Stupid, so hopefully she's going to go lay down somewhere else. Alright, getting into diphtheria. Diphtheria is passed through the respiratory, with respiratory droplets. Not too worried about incubation or communicability. Oops. But what I do want you guys to know is that for diphtheria, this used to be a terrible, terrible disease, illness, many years ago. They would literally condemn houses with diphtheria. As you can see, what happens is there's this grayish, bluish, whitish area that grows on the pharyngeal membrane, and it can actually extend into the trachea or cause airway obstruction. So yeah, it is a very serious, especially back in the day when they didn't have all the treatments they have now. But other symptoms that you're going to see are the sore throat, obviously, and then the enlarged lymph nodes. But remember that big white plaque in the back of that person's throat. So this is one of the condemned houses signs. When somebody would get it in the house, this is the sign that would go up on the front door. So the biggest things that the nursing care, sorry, my dog will not sit still. That's a stupid dog. Transmissions based on, or precautions are based on the transmission. So, you know, making sure these people are not coughing and then touching everybody else. Like I said, we need to monitor for respiratory distress because there is a chance for blockage. And then the treatment, antitoxins and antibiotics. Enteroviruses, these are once we get into it, you'll recognize it. But they're caused by the Coxsackie viruses. I just want you to be familiar with that term. These are all transferred by the fecal-oral route or the respiratory route. Not too worried about that one. General symptoms for enteroviruses are irritability, fever, anorexia, malaise, rash, and sore throat. So that's like the flu-like symptoms that I talk about based on every virus. Now we're going to get into specific enteroviruses. The most important one I want you guys to be aware of is because we do deal with this quite often is the hand, foot, and mouth disease. I'm sure, Kate, go lay down. Lay down. Almost everybody's heard of it, if not had it, or their kids have had it. It leaves these lesions in their mouth and then lesions on their hands and their feet. So you pair burning, terrible, annoying rash on hands and feet and their mouth with irritability, fever, anorexia, fatigue, rash, sore throat. It's a terrible, terrible thing. And it's a virus, so there really is no treatment. It's just treat the symptoms. Oh, I'm sorry, I'm bouncing around. Some other ones, the herpanginas, small gray papulovesical pharyngeal lesions. Don't worry a whole lot about that one. The enterovirus D68, you might hear some of that, but that is a severe respiratory illness that mimics asthma with the wheezing. So just make sure you're kind of familiar with, for sure, hand, foot, and mouth disease, and then keep that enterovirus D68 in the back of your head. Like I said, it's treat the symptoms. These kiddos are on contact precautions. Really, they are not generally, unless it's the respiratory one, the D68, they're not going to be treated in a hospital. Hand, foot, and mouth disease is a disease or an illness that they treat at home and basically quarantine the family and let it kind of run the course. So going into erythema infectiosum, better known as Fift's disease. Many of you may have heard of this one too. It sounds very technical, but it's just called Fift's disease, caused by the human parvovirus B19. Um, it's a respiratory and blood can transmit it, and not a big. But I will tell you to take a good look at this picture. The drawing of that kiddo right there has this rash on their face that almost appears like they've been slapped. And then on their extremities and on their trunk, it almost looks like a lace-type redness appearance. So make sure you look at this picture. It really shows you what Fift's disease looks like. So stage 1, flu-like symptoms. And then they might go a day or a week with no symptoms at all. And then once that 1 to 7 days are up, there's going to be that red rash on their cheeks that looks like somebody slapped that kiddo. And then that rash will start on the trunk and the extremities, the lacy rash. But if it is Fift's disease, it is completely backwards from hand, foot, and mouth disease, and that there's going to be no rash on their palms of their hands or their soles of their feet. Not exactly sure the dermatome or the nerve process of it, but I'm guessing that's why there is none on the palms of the hand or soles of the feet. So, stage 3, the rash is going to start fading. It might take a week, 2 weeks, 3 weeks, but if their skin is irritated or they're stressed out, that rash might actually come back. Droplet precautions. They're not going to be treated in a hospital unless their temps are so high and mom and dad can't get it down. And it's basically treat the symptoms. We had this in our house, and it was terrible. If you just look at this, it looks, oh yeah, that's a rash. But it also comes with fever, headache, body aches. It was not a nice week in our house. Going into Hib B, Haemophilus influenza type B. One of the influenza bacteria. If you remember, it can be transmitted direct contact or respiratory droplet inhalation. It starts as basically a viral upper respiratory infection like the influenza, but then that bacteria actually enters the bloodstream. It can cause so much more worse than just having that respiratory infection. Meningitis, epiglottitis, pneumonia, cellulitis, you name it, anything where that bacteria is going to places it shouldn't be. As if you remember that with Hib, we do need to treat all the contacts prophylactically. These kiddos are going to be on droplet precautions, and it's another one where we're going to be treating the symptoms. Influenza, droplet and contact with respiratory secretions. This one I do want you to be familiar with. I'm not sure if there is a test question on influenza, but this is one that we will be dealing with quite a bit in any setting that we're in. Even if you're working nursing homes, I've seen Hillview shut down twice now for influenza outbreaks. I've seen other nursing homes shut down. I've actually shut nursing homes down because of the influenza outbreaks out there. So I want you to be very, very have an understanding of this influenza. I've walked into the peds floor at Gunderson before and saw every room had a card outside of it because everybody was showing its symptoms of influenza. So this time of the year is really bad for influenza. Just remember that. You're going to see it in every healthcare setting that you're in, whether you're in the clinic, the hospital, the nursing home, wherever. Symptoms, these people are contagious. They will be contagious a day before symptoms start, up to 7 days after symptoms begin. When I closed down nursing homes, like wings of the nursing homes when I was working nursing home, we literally had to have it, I think it was 48 hours after the last person had their last temperature or their last symptom. So it gets pretty serious because nursing home, people die from this. Hospital, even peds, these kids that are immunocompromised, they will die from this. So it is a very serious illness. So acute onset, these people are going to have fevers of greater than 100.4. I've seen fevers up to 104.8. So these people are very warm. They're going to have chills. They're going to have a cough. They're going to have runny nose, sore throat, terrible body aches, headaches, anorexia. Basically, overall, these people are going to feel terrible. Nursing care for these folks, droplet contact precautions. Tamiflu is the big med here. And then we need to treat the symptoms. Make sure we're giving Tylenol to keep those temps down. And this is another one where we treat the contacts prophylactically. So if a family member has it, make sure you're talking to the doc and getting Tamiflu for the rest of the family because it will make it through the household. On the patient side of it, we have brought influenza into our house, and we literally all lived on the couch and in the living room for probably a good week. Nobody wanted to get up. We just had, our Sprite and whatever. Like, we had a big table in the middle and said, I don't care who gets it. Whatever you guys want, go ahead. But these people will feel terrible. All right, measles. This is one that is pretty well controlled right now, but I have seen, I think it was this one that I've seen a couple articles that it's kind of making its way back out. It is spread airborne, so you don't even have to know that you're in contact with someone who in 3 days comes down with measles. You could just be in a public area. So there is, 2 stages. 2 stages of measles. Stage 1, the prodromal stage. These kiddos might spike a fever up to 105 degrees. They're going to be lethargic and they're going to show malaise. They're going to have a cough. Coryza, if anybody's looked that up, that is just the inflammation of the nasal passages. And it can be severe. And then Koplik spots, they're kind of like white salt, like this one says, salt grain type in the oral mucosa. So then the rash stage will start a couple days in. It'll start on their face. It's this maculopapular rash that you can see on this baby's face. It'll spread to the trunk. It'll spread to the extremities. Generally dark red, maroon, purple in color. Nursing care, airborne precautions. Like I said, all this stuff will kind of make sense if you can sit down and look at each disease or each illness. If it's transmitted through the air, then make sure you're having airborne precautions. Most of these are just treat those symptoms and monitor for any complications, because if you are having a fever up to 105 degrees, you're going to be at risk for febrile seizures. So just know the symptoms and know basically how it's transmitted and if there's any specific nursing care. So going on to meningococcus. This one is really, I'm just kind of scooting through here. It kind of depends on where it settles and what the symptoms are. The meningococcus can actually cause meningitis, and then my words are gone today. This meningococcemia, I'm going the wrong way. Alright, so meningitis. Here's that flu-like symptoms. But it's also going to be accompanied with a stiff neck, decreased mental status, may lead to seizures and coma. So then it also may enter the bloodstream, causing sepsis, which is going to be the normal or the telltale signs of sepsis: the fatigue, the vomiting, cold hands and feet, aches and pains. This rash is actually, it might be maculopapular or petechiae, but once it goes this purpura that is shown in the picture, that's a really bad thing. And then they may actually go into severe septic shock. These kiddos are put in ICU to monitor for shock, to be treated for shock, and standard and droplet precautions because it is respiratory spread. And then we also need to monitor for respiratory distress. There's another one where we need to treat the contacts prophylactically. Mono, you guys will hear it's the Epstein-Barr virus. Transmitted with direct contact with body fluids, whether it's saliva, blood, semen. Also called the kissing disease because that's how, a lot of times how it gets spread. Boyfriend gets it, kisses girlfriend, girlfriend comes down with it. So symptoms are a lot of like the flu-like symptoms, the fever, the fatigue, abdominal pain, sore throat, enlarged lymph nodes. That's kind of not specific to mono, but what is specific is this enlarged spleen. There's a lot more to mono than what's on here. Kind of look at this picture here. It lasts forever, if anybody's ever had it. And the enlarged spleen, I don't know, oh, it already changes. I actually had a girl I went to school with pass away. She had mono. She was doing well. She was at home by herself because she was at the point of where they thought she was coming, she was healing up and getting to feel better. Her spleen had enlarged so much that she rolled over on the couch, and just that movement enough ruptured her spleen. It is a pretty serious illness, and it lasts, I don't know, 6 weeks. It lasts a long time. Mumps. Yeah. Acute symptoms. These kids are going to spike a fever. The flu-like symptoms. But what I want you to know is the characteristic signs. Their salivary glands, the parotid, the sublingual, and the submaxillary glands are all going to swell. So you can see this kid here. He's got some swelling of those glands. And because of that swelling, they're going to have earaches. They're going to have headaches. They're going to have pain when they're chewing. So they're going to have a decreased appetite, and they're going to be pretty lethargic. So if you kind of look at the characteristic signs, it'll help you remember the rest of them. Yeah, these kids are pretty miserable. They can't eat, and plus they've got a fever, muscle aches. But if you look at the headache, earache, the pain of chewing, that's all mainly because of that big swelling on the side of your face. And if you remember that the big swelling on the side of your face is from mumps, it'll help you get through all of it. Here's another picture of it. Basically, treat the symptoms. I did hear, I think it was last year, that mumps came back out for a little while to rear its ugly head. Scared my daughter. She had swelling from something else. I don't really remember what it was, but it came on the radio about mumps, and she's like, "Oh, Mom, what's the signs of mumps?" And I just listed everything she had, plus the swelling on the side of her face. It's kind of funny. All right, going on to pertussis or whooping cough. This is another one that's making its comeback. I know just a week or two ago, we got notification that there were at least 3 children in the Vernon County area, which is not a big area, but at least 3 children that had been diagnosed officially with pertussis or whooping cough. Sometimes they will diagnose these kids based on symptoms, but they don't report it until they are officially diagnosed. So it's in the respiratory secretions of these kids. Not going to go into all that. There's 3 stages to pertussis. The catarrhal stage, or stage 1, cold symptoms. It's just normal cold symptoms for a week or 2. Then it's going to get into this paroxysmal stage. It's also called the cough stage. These kids are going to be coughing, and it's almost like they sound like a seal. So they'll cough, and then when they go to breathe in after they cough, you'll hear a it's kind of like that stridor. So they'll cough, 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 and then have that stridor. This is one of the things that I was talking about earlier, where that whoop, that stridor, will be absent in kids that are vaccinated with pertussis. That video right there, actually, I wonder if I can bring it up. I probably can. It'll take me a little bit. Maybe.
Whooping cough. It's a bacterial infection that's risen to epidemic levels in some parts of the U.S. In adults, the symptoms can be mild, but if the infection is spread to a baby who hasn't yet received a full course of vaccinations, whooping cough can be very serious. Here's more on how to handle this disease.
Are you being shy?
21-month-old Pedro Escueda's symptoms started out like those of a typical cold.
He had a little runny nose and started having a little cough.
But over the next 4 to 5 days, Pedro's mom, Chelsea, says the cough got much worse.
It was nothing I've ever heard before. He was coughing and doing the whoop. He'd vomit.
And he couldn't catch his breath. When they took Pedro to the doctor, the coughing had subsided, so they figured maybe it was just a cold or some other infection. But Chelsea knew there was something else wrong.
I will tell you that that is a common thing, that when kiddos with pertussis or whooping cough, they get out in the cold, like to go to the ER or whatever, and that coughing, because of them getting cold, the swelling kind of goes down a little bit. So you will hear parents say, well, they were doing it at home and now I get them here and they're not doing it. Let them sit a while and that cough will come back.
So the next time Pedro had a coughing fit, her husband got it on video. A nurse practitioner saw it and diagnosed it right away.
And she saw it. She goes, that's pertussis.
Whooping cough is also known as pertussis. It's caused by a bacterial infection that is spread from one person with whooping cough to another person.
What is he doing?
Dr. Thomas Boyce
Another
says
thing I want to tell
whooping
you,
cough is particularly...
that little bottle in his hand, that white thing that's sitting next to his toy, that is actually an antibiotic. It's called a baby bottle or an isometric bottle. They make it in balls as well. So that way people who are, at home can actually administer their own antibiotics. They're really kind of a cool thing. I just don't want you guys walking into seeing one. I walked in and didn't know what it was. I was like, oh, what the heck? I'm supposed to teach you how to use this? Let's see. But just, that's what they look like. It's called a baby bottle or an isometric bottle.
Particularly tough on kids younger than Pedro, who haven't had the
You can
full
see the,
course of vaccinations given
prescription
at
on it.
2, 4, and 6 months.
They're particularly susceptible to getting infection, and because of their small airway, they're particularly susceptible to having very severe disease.
You see, the infection happened in the airway or trachea. The pertussis bacteria produce toxins that irritate and inflame the airway. This causes the severe, repeated cough that lasts for months.
They call it the 100-day cough.
Pedro and his entire family took antibiotics to treat the infection and prevent further spread. Now he's back to health after months of illness. Dr. Boyce says babies usually get whooping cough from adults who have a mild infection. He says that's why it's important for adults to get booster vaccinations every 10 years. Ask your doctor for the tetanus diphtheria shot that also includes a pertussis booster. For Medical Edge, I'm Vivian Williams.
Oh, now I gotta get back to you. Yeah, so you heard them call it the 100-day cough. They'll have like a little cold symptom for a little while, then they'll go into that terrible coughing stage like you heard that little guy do. And then it goes in, I have 6 to 10 weeks, but obviously I've called it the 100-day cough before because symptoms will gradually resolve, but that cough will linger and linger and linger. So, most important, these kiddos are going to need antibiotics. Family might need antibiotics depending on what their symptoms are. And you really need to make sure that they're breathing okay. I've seen kids turn blue with these types of coughs because the reason they got that stridor is they cannot get the air in or out because of that swelling because of the pertussis bug attacking their trachea. Pneumococcal infections, this kind of depends on where the infection is located. Otitis media, ear infection, it can be a pneumococcal infection. It starts with an upper respiratory, and a fever leads to ear pain, decreased appetite. Bacteremia might be caused by pneumococcal, fever, decreased level of consciousness. Basically, it's bacteria in the blood. So if you've ever seen a septic workup, this is what it's going to be. Blood cultures are going to be done to determine what the causative factor is. Pneumonia, all the same symptoms as a regular pneumonia, and can actually be also, pneumococcal can actually be a cause of meningitis. Treat the symptoms, and then docs will order antibiotics based on the culture and sensitivity. Poliomyelitis, thank goodness that this is a illness that is making its way out. I haven't heard any new news reports that it's coming back. Also an enterovirus. Not so worried, but polio. You've heard of people with post-polio syndrome. That's what this is. So if you look at this little boy, there's a lot of musculoskeletal defects, and they linger. They remain. So there's a mild illness where they get the low-grade fever and the sore throat. May develop into meningitis. They may have paresthesias, but that's the mild illness. Serious illness, which is actually more common, or was more common, these people are experiencing paralysis on one side. Most of the times it was their legs that were affected. Like I said, the residual paralysis is common, and it can actually affect the respiratory muscles. I had a guy that I just cared for before I came to Western full time, and he had post-polio, and he was literally, one of his legs was in a brace because if he stood on it, it would buckle, his knee would buckle, and his spine was so curved that he sat crooked in his chair, but that was just how he sat. Yeah, a lot of residual issues with polio. You can see this little guy here too is using crutches to walk, and those are long-term crutches. Monitoring for respiratory distress because the muscles can be effective, and then treat the symptoms and help them through it. Like I said, polio is really made its ugly head hide, but this is one illness that be on the lookout for it coming back. Roseola, also called sixth disease. It's caused by the herpes virus, one of the herpes viruses. Prodromal stage is basically the fever. Anything greater than 103, they have very, very, very high fevers with this. And then once it progresses into the rash stage, it's going to be a pale pink maculopapular rash that starts in the trunk that goes to other areas. Can last hours, can last days. Kind of depends on how serious it is. And once again, it is just basically treat the symptoms. Keep that fever down. Keep them from going into febrile seizures. Rotavirus. This is another one that I am not a huge fan of. Or I should say there is a vaccine against the rotavirus. My children never got the vaccine, but I know my nephew was born 2 months early, and he received the rotavirus while it was still in like the clinical, whatever it's called. They were researching it. They hadn't let it out for everyone yet, but Gunderson was trialing it, I guess. Anyways, rotavirus is transmitted the fecal-oral route. Anytime there's direct contact with any object that is contaminated, and as you know, babies, they put everything in their mouth, so this can be a huge, huge risk factor for babies. Here's just a picture of the side or the symptoms, but we'll get into it. They're going to have an abrupt onset, fever, vomiting, and huge, huge, huge risk of dehydration with rotavirus. Diarrhea will start a day or two later, and these kids can produce 20 stools a day for the next 3 to 8 days. So it is a terrible illness. It also hits like the elderly in the nursing homes as well. But going back here, you can see what some of these symptoms are. Myalgia, which is a muscle pain, malaise, headache, watery diarrhea, abdominal pain, nausea, vomiting, low-grade fever. It can actually cause intussusception. The rotavirus can, and you need to monitor for other members of the household with it. That being said, with the vaccine, which is what this baby is getting right here, it's not a shot. But my nephew actually got that and got the intussusception from the vaccine and not the rotavirus itself. So if you can imagine a 4-pound little baby, he was green. It was terrible. He had tubes and everything. I think I was 16 when he was born, so not a whole lot of healthcare experience. Seeing my brother, who has no healthcare experience, he was a motorhead, go through his firstborn child that was green and looked like an alien. This is one of the other reasons that I'm not an anti-vaxxer. I'm just very particular about what I put in my children. So like I said, these babies are a huge risk for dehydration. They're pooping, they're puking everything out, and they got a sore throat, so they can't take anything in. So just kind of make sure you know about this one as well. Rubella, droplet spread, nasal. Prodromal stage, like I said, low-grade fever, 4-chimer spots. As you can see, it's the petechiae in the soft palate of the mouth. Then it'll go to the rash stage. The pink maculopapular rash on face and the neck spreads the trunk and the legs. Again, another one that is treat the symptoms. It'll run its course. Streptococcus, group A strepto, is also called GAS. You'll see that in the next slide. Respiratory transfer, or and like the kid with the impetigo down here, contact with the skin lesions. This is what most people see as strep, is the white spots on the back of the throat on the tonsils. So basically, the symptoms are based on what type of infection it is. If it's strep throat, obviously sore throat, dysphagia, fever, chills. The group A strep RTI, it's just respiratory infection. Rhinitis, fever, irritability. Strep can actually, untreated, it can lead into scarlet fever, where that they are getting this red sandpaper rash that starts at the neck, goes to the arms and legs. They actually have a strawberry tongue. I'll show you that on the next page. Or they also have the skin one, the pyodermal. It's also called an impetigo, which is this honey-colored crust on their mouth, around their mouth, their nose. Can be pretty uncomfortable. This strawberry tongue here, it's the red, swollen tongue with the little raised dots on it. Droplet contact precautions depending on type of infection. These kids are going to get antibiotics. We need to teach parents good hygiene and to throw out anything that the kid puts in their mouth after the course of antibiotics. Alright, I think we're getting closer to the end of all these. Tetanus. We all know that we get tetanus shots after we cut ourselves or do something outside, step on a nail. Anytime that wounds are exposed to contaminated soil or products, could be like a puncture wound, like stepping on a nail outside. Anytime there's a crush injury or like a trauma caused by a rusty object. I've seen it given with dog bites. I know I've had a couple students give tetanus shots in the ER at Boston this rotation. Symptoms start out with fever, sweating, headache. That's accompanied with neck and jaw stiffness. They might actually have painful facial spasms, which cause difficulty chewing and swallowing. Overall muscle stiffness. They might actually have what's called rhizus sardonicus, where they actually look like they're smiling because their facial spasms are so bad. And then they also have late stage of tetanus is the where they're actually hyperextending their body because of these spasms. So you can see the smile on their face. It almost looks like a smile, a weird, painful smile. But how they're hyperextending. Yeah, tetanus is a pretty nasty illness. So we need to make sure that we are making sure that there's not a lot of stimulation for the kiddo. Treat all the symptoms. Those wounds need to be cleaned and debrided regularly. Antibiotics and recovery can actually take a long time. I'm going to pause here. There, I think it's restarting. Alright, getting into Lyme's disease, caused by a tick bite, a deer tick bite that is infected with Borrelia burgdorferi. These ticks need to be attached for at least 36 hours so that the toxin can be transferred. And it's not just any deer tick. It's a deer tick that is infected with Borrelia. This is just kind of a nice little cartoon for you guys to look at when you're trying to learn the symptoms. Characteristic symptom is this erythema migrans. It's better known as a bullseye rash. You can see it in the picture here. That is probably the most common symptom of it. You can have Lyme's disease without having this bullseye rash. Fever, chills, fatigue, body aches, swollen lymph nodes. So basically it's terrible flu-like symptoms in the beginning, accompanied or not accompanied by a bullseye rash. Bailey was actually diagnosed with Lyme's in January, right about the I don't know, she was probably 10, so it was just before she was diagnosed. But she had a fever of 102 for, I think we were up to 32 days. Fatigue, body aches, all these non-specific complaints. So I told him, I said, well, run a Lyme's test on her. Oh, no, it's January. It's not going to come back. Sure enough, it came back, and I said, okay, run and tell me when we were infected. And it came back that it was a recent infection within the last 30 days. So, or last, I don't know, it was just over 30 days or whatever. It was obviously, she'd gotten it during the winter. This can actually progress into worsening fatigue, meningitis. You can see this lady here has facial nerve palsy. It can attack the heart, can cause muscle pain. And then if it goes untreated or, where you don't have the rash or you don't know, can actually go into arthritis and many, many other issues. This is another one of the causes of the POTS that my daughter has. Biggest thing with Lyme's disease, we need to teach our parents how to take that tick out so that everything is removed. And that these kids need to be covered in head to toe with hats and long sleeves and long pants and long socks so that if they are out in the woods, they aren't getting exposed. Treated with a long course of antibiotics and, again, treating the symptoms. So here's just ways to remove a tick, how not to do it, and then two cute little kids all covered up in there in the woods. Malaria, getting into all these bug transferred ones, just transmitted by a female mosquito, could be transferred through blood transfusion or even an organ transplant. Flu-like symptoms is basically malaise, headache, vomiting, diarrhea, high fever. So what do we do for nursing care? Obviously, we're going to fluid replacement because of the high fevers, antipyretics to try and keep them down like Tylenol, monitor for anemia, and chloroquine treats most of the malaria. These people will be on standard precautions because, like I said, it's transferred by a mosquito, a blood transfusion, or an organ transfusion. And then make sure we're monitoring for any signs of worsening symptoms, confusion, seizure, shock, can't talk. Rabies, basically when an animal is infected with rabies and they bite a person, it transfers to the brain, and that's where the rabies multiplies. It is a complete brain illness. First stage, these people are going to have fever, they're going to have headache, they're going to be a little nervous, and they're going to have paresthesias at the site of where they were bitten. So nothing too specific. The neurological stage, it started attacking brain function. So these kids are going to be agitated, they're going to be anxious, confused, they're going to have abnormal behavior, they might be delirious, hallucinations, they're not going to sleep. So it can actually, or it will progress to coma, respiratory failure, and death. Generally, they say that a person who is bitten will die within 10 days without getting the vaccine. The vaccines, I think I got it, yeah, right here. It is terrible. So days 0, 3, 7, 14, 30, and 90. It's either a 5-dose, 4-dose, 8-dose. Yeah, it's a very, very terrible regimen to go through. But they will be given a series of injections as prophylaxis because they can't know if the animal has rabies until it's basically a autopsy on the animal. Their brain needs to be tested. Generally, if the rabies progresses, like they get bit and they don't go in for the injections, the post-exposure, the person will die within 10 days. And one big weird thing, because they are have so much difficulty swallowing any fluids, these kids that end up with rabies will actually be hydrophobic. They'll be scared of water because they link it with choking. Yeah, I think that's pretty much it with rabies. And then Rocky Mountain spotted fever, transmitted by tick bites with this Rickettsia rickettsii. It basically attacks the body early. These people are going to have fever, malaise, headache, muscle aches, anorexia, nausea, vomiting, diarrhea, general flu-like symptoms. Then they might start developing this red maculopapular rash, right, a few days after the symptoms start. If it progresses to that petechiae down on the right-hand side, that means that the Rocky Mountain spotted fever is much more severe. They're at high risk for bleeding because it's attacking all the clotting. They need to be monitored in an ICU. They are going to be obviously on antibiotics. And again, this is another one where I need to teach those parents, have those kids wear long pants, long socks, long shirts, hats, anytime that they are in wooded areas where they might pick up these ticks. And this is because of the issues with clotting and all of that, and the effect that they have on the tissues. This is a person who got bit by a tick and got gangrene caused by Rocky Mountain spotted fever, and they will lose that hand. There's no coming back from that. All right. Getting closer to the end. Some of these I'm just going to fly through because they are so common. You guys don't need to hear me rattle on about ear infections and stuff. Eye disorders. A lot more common than it used to be. Kids who are blind or have partial vision may have other disabilities. And legally blind is considered an acuity of 20 over 200 or worse in that eye. All right. Infectious conjunctivitis, basically inflammation of the conjunctiva. You guys have dealt with this. It's basically pink eye. That conjunctiva is red and swollen, and there's yucky discharge. So depending on what type of conjunctivitis it is, it will be different discharge. So bacterial, that discharge is going to be purulent green, and it's actually going to crust over on the eyes. Viral, discharge is going to be more serous. And then if it's related to allergies, that drainage is going to be watery and it's going to be thick, and that kiddo's going to itch. Periorbital cellulitis. You guys know what cellulitis is. This is just the cellulitis on the eyelid and the surrounding tissues. It can be caused by staph strep. Same with regular cellulitis. Hyperopia, farsightedness, myopia, nearsightedness, astigmatism. The light rays are refracted differently. Images might be blurred. Strabismus, inward or outward deviation of the eye. One eye might be going in or out. Amblyopia is more of a lazy eye, so that when they've been reading for a long time, that eye kind of floats, becomes lazy. I'm not really sure why this is in the kids section, but cataracts, the lens is opaque, they can't see through it. Glaucoma is intraocular pressure that will damage the eye, might cause blindness. Color blindness is a lifelong issue. They have a problem distinguishing between red and green. But you can see here what the red and the green looks like. Otitis media, we kind of talked about that in the pneumococcal one. It's inflammation of the middle ear. Generally, these kids are going to have a respiratory infection before an ear infection, and that's because as you can see in this picture here, the eustachian tube in the infant is flat. It's more horizontal. Does it have it here? And in the adult, it actually stands up a little bit more. So it's easier for bugs to crawl in the eustachian tube in an infant. Here's the big, long, drawn-out explanation. Otitis externa is just the inflammation of the external ear. A lot of times you see it. It's also called swimmer's ear. You know, in the summer, these kids have been out swimming in the pool. Nosebleed, the epistaxis. If it is if the kid is bleeding out of one side of their nose, it's an anterior bleed, and if they're bleeding out of both sides, it's a posterior, just meaning that anterior they're bleeding from closer to the outside of the nose, and posterior they're bleeding from farther back. If it's an anterior bleed, generally it's related to dryness or trauma or nose picking. When it's from the posterior septum, there's something else going on. So obviously the one-sided nosebleed is a lot less severe than the both sides. So treatment for an anterior bleed, these kids need to sit up straight. We need to stay calm. They need to stay calm. Have them tilt their head forward because if they tilt it back like a lot of people think they need to do, it's just going to run straight down the throat. If they had their head forward, they can remove the Kleenex or can drain into a Kleenex where it's not going into their stomach. You need to make sure that either you or if they're old enough, they're squeezing their nose just below their nasal bone for 10-15 minutes to get it to clot up. If it doesn't stop, they may need to be seen and have a cotton ball or something minor inserted into their nose so that it stops. If it's a posterior bleed, they're going to need to do some packing because normal treatment of a nosebleed will not do it for a posterior bleed. They're going to need to be seen. So what do we need to do after bleeding is stopped? We need to really make sure that our kids are not sneezing or blowing their nose for up to 24 hours. Teach them not to stoop or drink hot liquids or take hot baths or showers because that will all dislodge the clot and they'll start bleeding again. Nasopharyngitis, just an upper respiratory infection, common cold. Sinusitis, obviously sinus infection. Inflammation in the maxillary, the ethmoid, the frontal, the sphenoid sinuses. Can be viral, can be bacterial. You guys all pretty much know what a sinus infection is. Tonsillitis can be caused by virus, bacteria, infection or inflammation of the tonsils. Can be if it's recurrent, then they're going to need to look at removing the tonsils. So, dental emergencies. There's the tooth fracture. There's the luxation, which is the partial where it's coming out, or the avulsion. It's a complete removal. If it does come out, if it's reimplanted within 30 minutes, it may actually survive. I don't like this part. Going into environmental influences on the kiddos. Physical abuse. It's just the deliberate maltreatment of another individual that is made to cause pain or injury, may result in permanent or temporary disfigurement or even death. So it's basically the hitting, the slapping, the biting, the kicking, the whipping, the burns. Could be immersing the body in scalding water, shaking that baby or that kid, throwing the kiddo against the wall, down the stairs, against windows, breaking bones, choking, gagging. Can also be deliberately giving higher doses than of meds than prescribed, or just skipping their meds altogether. There's so many examples that I could give here. I took care of it. I think I told a couple people about the 17-day-old baby that had healing fractures, um, where the dad had gotten upset with the baby because it wouldn't stop crying, and he hit him against the bed. I've seen parents not give seizure meds because then the kid was basically post-ictal all the time, and he was a lot easier to deal with when he was tired and sleepy than when he was running around in his little normal 2.5-year-old self. And then I also do have a friend that was very, very much physically, emotionally, everything abused, that was able to get out of it and is doing quite well considering. The story, and I usually do have I usually have her video playing and we do face-to-face, but I'm not going to put it up on here. Physical neglect, deliberately withholding or not providing resources to a child, failure to provide for the basic needs. This is including school and anything else that they may need, health care, medication, you name it. Supervision, nutrition, hydration, hygiene, shelter, healthcare. Emotional abuse, shaming, ridiculing, embarrassing, insulting the kiddo. May include destruction of their property. If you don't behave, I'm going to break your toys, and actually going in and breaking the toy. Can also be verbal abuse. Yeah, it's not a nice thing. Emotional neglect. Caretakers emotionally unavailable. Their interactions, whether it's mom, dad, or just another caregiver adopted, their interactions are generally cold, lacking sensitivity. The parent might be an alcoholic or a drug addict, or they might be mentally ill and unable to care for their child. Sexual abuse, obviously that's what it is, exploitation of a child. So anytime that we as nurses are working with kids, that being said, elderly, adults, whatever, if we suspect that a child's being abused, we need to report that suspicion right away to the CPS. If you look at it in another aspect, that it's not my responsibility to investigate and determine if they're being abused. It's my responsibility, because I suspect that child is being abused, to the CPS can do the legwork and do all of that, but I need to bring it to their oh gosh, my words are gone. But I need to bring it up to them so that they can do that. If I suspect abuse and I don't report it, I can be just as guilty as the person that's doing the abusing. This was the case when my friend, the school reported it. They went out, the dad sat with a gun behind his back and said, if you tell anybody that I've been abusing you or the situation that's going on here, I'll kill you and everybody else in this house, including your sisters. So they came out, the kid said, oh, nope, it's okay. And then it was dropped. They came out 2 more times. But it really needs to be, if you really feel strongly that there is something going on, be that squeaky wheel. Don't let these kids fall through the cracks, because like in my friend's case, she fell through the crack 4 times. and she had the worst life I've ever heard of in my life. I can't listen to her story without crying. So be the squeaky wheel and be these kids' advocate. If you think that there is abuse, make sure you're reporting it. Poisoning. Kids are curious, tend to eat different things. It's the second leading cause of unintentional injury or death. A lot of times these kids are eating cosmetics or personal care products, pain meds, cleaning products, foreign bodies, or topical. Those are the top 5 poisons ingested by kids in the last 5 years. Lead poisoning. Kids actually absorb and retain more lead than an adult. So if an adult's not showing symptoms, that's only because they're not retaining as much. Generally, these are kids that are 7 or under that are able or that absorb and retain more lead because of their weight. This lead, when they have lead poisoning, it interferes with all of their cellular functions, especially in the nervous system. Their blood cells are not functioning correctly. Their cells in their kidneys are not functioning. So there's a lot of issues with lead poisoning. A lot of neural stuff might be decreased IQ scores, cognitive deficits. It affects their hearing. There might be growth delays. For the fetus, might actually have some deformations, born with a low birth weight, or even an early birth, can actually cause encephalopathy, and then lead to coma and death. So it's a pretty serious condition. It's kind of getting out of the way now, but as people move into like old houses, it's a risk, because they have all the lead-based paint that they have used to paint their houses. Even if they painted the windows and they haven't replaced the windows. If you place a crib next to the window and the kid eats the paint, they're ingesting the lead and they might actually have lead poisoning. Well, that was a very long one. If you guys have any questions, please let me know. I tried to kind of get rid of some of the extra information that we really don't need, but I don't feel like I got rid of a whole lot. I did put up that Word doc that has the illnesses, the transmission, the characteristic signs. I'm really more concerned about you guys knowing those characteristic signs of the illnesses rather than knowing every single, illness that has which specific flu-like symptoms are they going to show. Trying to think what else. Yeah, I think that would probably be it. But if you guys have questions, please let me know. I will be working on my computer the next couple of days, so let me know and we will see what I can get you. All right, have a good weekend, guys.